So just to kind of continue on from the previous video, your nurse regulation, they really look at all of these requirements and all of these aspects. If you happen to get any kind of disciplinary action, it does get reported to the Board of Nursing, and they have set guidelines on how to proceed. Nursing standards. There's a table in your fundamentals book, table 1.3 on page 114, that would be good to look at. Nurses are guided by standards of practice. And the American Nurses Association, or the ANA as you will hear it called, they have a definition of the standards every nurse is expected to incorporate into practice. It helps judge performance and sets employer expectations. These are some influential nursing organizations that are important to maybe be a part of. If you, let's say you get out of school and you want to go work in the ER, you can be a part of the Emergency Nurses Association. Each state has their own nursing association, like Tennessee Nursing Association. We have the National Student Nursing Association, like we really want you to be a part of. There's all kinds of different nursing associations that are beneficial to be a part of. They help you stay up to date with changes and education requirements. And there's just a lot of benefit to being a part of those. So for purposes of nursing care, the reasoning for doing what we do, there's health promotion, there's illness prevention, health restoration, and then end-of-life care. And your end-of-life care really focuses on the comfort, relief of pain, family support. So out of these examples, which of them is an example of an illness prevention activity? So we're trying to prevent illness from occurring, which is one of our purposes in our care. So it'd actually be administering immunizations. So in healthcare, we really can work in various different settings. These are some of the settings that you may be doing clinicals in, that you may be involved in. So we have hospitals, and you have various different people who can work in the hospitals. You have doctors, you have physician assistants, nurse practitioners, registered nurses, LPNs, we have CNAs, we have techs. Nursing students can even get jobs in the hospital. They can be primary, they can be rural in different communities. We can have trauma centers. There's lots of different sizes of hospitals. In the hospital, they do require 24 hours of observation. So nurses are used to working around the clock. There's always somebody that's there taking care of a patient. Even in the midst of this big snowstorm, nurses have to make it to work. A lot of times nurses will stay at the hospital in a designated area so that we make sure the patients are being taken care of. They do provide basic services. They have radiology, laboratory. There's usually an ICU, a surgical area. Some facilities offer maternal newborn. We also have extended care facilities. This can provide care for over a month. Typically, your hospitals are more short-term. You're usually not in the hospital very long. But your extended care facilities, they can be to help provide IVs, wound care, just skilled nursing care to kind of help people get some therapy and get back on their feet. A lot of times they don't have a medical doctor on site. They could have one on or off site. They may have a nurse practitioner, and then you have your nursing staff, the RN, LPN, and CNA. Your ambulatory care centers, these are outpatient services. A lot of times, like your same-day surgery, outpatient surgery, could be chemo, and you may have all the various positions working there as well. Home health care agencies. So this provides care in the patient's home. If you really like being out and about and driving around all day and just having change of scenery, maybe this one might be for you. They can provide therapy, they can do wound care. So there's various different roles that can be there as well. And then community or public health centers, typically this is going to be your RN, and their care provided at certain sites like schools or out in the community from homeless. And then independent living facilities, this one is more of like your retirement homes, kind of like your assisted living, where they're living in a community of seniors. So this next slide, this is going to be really important because this is going to come up in every semester. Different degrees of complexity as far as their care. So when we talk about primary care, your general care, if someone is getting primary care, think about your primary care doctor. You go to your primary care doctor, usually to get a physical every year, and the reason that you are there is you're helping to prevent illness and help promote illness preventions. You're trying to really prevent the disease from occurring. Secondary services, this one is more of your early diagnosis and treatment. Could be hospital care, could be outpatient, but you're dealing with the problem that has arisen. You're trying to get treatment for whatever problem is occurring. So, it could be something like going to the urgent care because you have strep throat and you're starting to get medications because you're dealing with the problem. You're getting an early diagnosis and treatment. And then your tertiary services, this is more of your long-term rehab, care for the dying. It's more of your rehabilitation, and you're there for more of a long period of time. So, for example, patient has a sore throat, no cough, and a mild fever, visits the friendly urgent care, and is prescribed penicillin for strep throat. Which category would we consider that one for being? And it would be secondary. Because if you think about it, I gave you this example, but they're dealing with the problem. They're getting an early diagnosis, but they're starting to deal with the problem of the strep throat. So this slide is going to talk about who all is a part of our team. So in nursing, we really work with a team to help take care of a patient. There's all kinds of different people involved in taking care of that one patient. We may have the physician, we may have an advanced practice nurse. You may see that abbreviated as an APRN, Advanced Practice Registered Nurse. We might have a PA, an RN, an LPN. We might have a CNA. You may have a pharmacist, or you may have physical therapy involved. We work and collaborate with all of these different people in the interdisciplinary team. So we really work together. So as far as how patients help pay for their health care, insurance can get a little confusing, but it's a good idea to have basic knowledge about the different avenues. When you want to think about insurance, there is private insurance that people may have, and a lot of times it's very expensive, but it does provide some protection from really large bills. Healthcare is very expensive. Hospital stays are very expensive. If you've ever had any hospital care, you may know that, but it gives them a little bit of benefit. A lot of times you'll get that with your employment. Wherever you're employed, they will offer you the benefit of this type of insurance. There's also different government financing available for your insurance. There's Medicare, and a good way I try to remember these, or to tell people to remember them, your Medicare is you're caring for a older person. So they're typically 65 years or old plus, or younger people with a permanent disability. They need care. And then Medicaid, they need aid. So I kind of compare it to like financial aid. You maybe need aid to help paying for your tuition. They may be low income and need additional aid to help pay for their insurance. There's also children's health insurance programs and then specialty programs like through the military, Indian Health, and other avenues. So, some different roles also that we're going to talk about in nursing. There are non clinical and there are also clinical roles that you can choose to be a part of. So, like I mentioned, if you decide that you go into nursing and you work with patients for several years and you decide, okay, it's time for me to step away, you can go into a non clinical role. So, some non clinical roles that you may see there's a nurse researcher, and they work to investigate problems that are going on and find research to back that up. There's nurse administrators, which, if any of you all want to be a boss someday. Nurse educators that help teach. Nurse informaticists, and they work with data. And then nurse entrepreneurs, and they work with consulting. And then you have your advanced practice nurses or advanced practice registered nurses. These people are clinical. They work in the clinical setting. You can be a clinical nurse specialist and be specialized in a clinical area. Maybe you have an area of focus that you want to be your expertise, and you can choose that, and you could go into nurse specialist. Nurse practitioners, a lot of times they focus on primary care. CRNAs, they administer anesthesia to patients whenever they're in the surgical suite. Certified nurse midwives, they work in women's health, help with pregnancy and delivery. And if you decide to go the nurse practitioner route, there's a lot of specialties that you can do just in that one category. You can be a family nurse practitioner, a pediatric nurse practitioner, a gero nurse practitioner, acute care, women's health. There's just so many different options. So as you go throughout your career, there is a model out there, and Patricia Benner put this model out there. And in my notes at the bottom of the PowerPoint, it does describe each specific stage from novice to expert and detail about how each stage follows through. But as you go through nursing school and as you choose your career, this is a model that says you're going to start out as a novice and you move along throughout your career until you are an expert in your field. So you all are kind of in the novice stage right now. You're nursing students. You're just starting to learn all there is to learn. But kind of look at that model and see everyone moves in it in a different manner, and it may take everyone a different amount of time to move through those. So it may take several years before you get to that expert level, but it's just kind of a guide to help you and know where you're at and kind of how you move through that as you go throughout your career. So as a review, we've covered all of these topics, and I encourage you to kind of just pull out these objectives and make sure that you can hit these and say, yes, I know what that is. I know the different forms of nursing education.